Hey everybody, Dr. Jason Denise here. Had a couple of people ask me about mental health during the coronavirus outbreak, and I think that's such an important topic. We've never been through anything like this before, and a lot of people are struggling with anxiety related to it. Before I go any further, I just wanted to share some resources that are available to you. One is Connex Ontario, Connex Ontario. They have a website, or you can reach them on the phone line, 1 531 2600, and they can help you out with mental health resources. If you're going through a crisis here in Chatham, Kent, you can call the Mental Health Crisis Line, which is 1 299 7447. Of course, you can always reach out to your primary care provider, and a lot of times a virtual encounter can be set up for you where you don't necessarily even have to go to the office. And the other thing, too, is of course, if you're feeling acutely suicidal or you know somebody who is, get to the emergency room and they can help you there if it's an emergency situation. Um, I'm not a counselor, but just some simple things that you can do also to keep yourself grounded during this outbreak and the crisis that we're going through currently. The three S's is the way I think about it: shut down, satisfaction, and simple. With shutdown, I mean take some time each day where you shut off completely from the news, your devices. If you can shut off your phone, of course, do so. So you're not getting the pings and everything. And get away from the coronavirus entirely for a period of time. Go do some physical exercise. Enjoy the outdoors if you're able to. Um, meditation. Go online, learn how to meditate. Take some time where you empty your mind of everything corona. The second thing is satisfaction. Basically, taking stock of all the good things that are going on in your life. So many people, of course, are going through either economic hard times, health related concerns, etc. It's a matter of looking around and saying, you know what, who are the friends of my life, my family? Um, I got food in my fridge, I have a bed to sleep in, chair to sit on, whatever it may be. But if you go through that mentally and specifically, you'll find that you realize all the positive things still going on, and it's hard to feel anxious or worried when you're doing that. So once a day at least, or multiple times a day, just kind of list those things, and then reach out to somebody who maybe needs help. Give a phone call or social distancing, not social isolating. Call up a relative who may be elderly and needs help, or a neighbor, somebody that needs to touch base, and just make sure they're okay, and that will help you as well. The third thing is keeping it simple, and there's three S's here as well. Make sure you stay home, of course, unless you have to get groceries or do something essential, medications, etc. Stay home. When you do leave the house, make sure you social distance. Do your part that way. And then sanitize, and just make sure you wash your hands. If you've been out, come home immediately, wash your hands. Or if you're about to prepare food, touch things in the fridge, etc., washing your hands for 20 seconds. Keep it simple though. If you do those three things, you're doing your part to help prevent the spread of coronavirus. And don't be hard on yourself. If you're doing those things, you're doing what the government's asking currently. And if things change down the road, well, we'll adapt to that. But make sure you're doing those three things, and then you're doing your part to stop the spread. And don't dwell or stress about it beyond that. You're doing your part at that point. So I hope that helps a little bit, and some of the resources that are out there. Please stay safe, and we'll get through this all together. All the best.